Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please don't stop watching. I'm composing a spontaneous comment or question. The guest can choose not to say anything while this is occurring. This is natural discourse when an augmentative and alternative communication device user is communicating with a non-augmentative and alternative communication device user. Today I have Susan Kolukisa, a special education teacher and mother of 3, with me, to discuss the vagus nerve stimulator for epilepsy as her son, Dan, has it. She founded and runs a charity called Team Dan, in addition to also advocating for mental health and empathy for siblings of children living with complex medical issues. Dan is a 24-year-old living with epilepsy. He is a creative person who loves to express himself through photography, art, and music. He has an incredible sense of humor despite the challenges he has faced. Welcome, Susan.
Hello, it's so good to be here. Thanks for having me.
Please introduce yourself.
I'm Susan Kolukisa. I'm a wife. I'm a mom of 3 grown children. I'm a special education teacher. I teach preschool in Waterbury. And I'm a dog mom and a cat mom. I love all things related to being at home. I love cooking and I love interior design and I love gardening. So my family is a big part of who I am. I just love being around them and being at home. So I've had a journey.
Do you work with kids with seizure disorders as a special education teacher?
I do not have students this year that have seizure disorders. There are some students in our building that do. And I know that epilepsy is a comorbidity with things like autism and cerebral palsy. So I know that it's something to be aware of and be, alert to, since I'm working with that population of students. But this year, I don't have students that have epilepsy now.
Since anyone can have seizures, what is epilepsy?
Epilepsy is actually the 4th most common neurologic disorder. And it's just kind of a glitch in your brain where there's irregular impulses that cause various things. There's over 40 different types of seizures that people can have. I think the movies have made it that appear that it's one kind where you drop to the floor and you shake. But there's lots of other kinds, absence seizures and things like that, where you might not even be aware that the person is having a seizure. It's just a disorder of recurring, unprovoked neurologic disturbances in the brain.
Dan was diagnosed at 12 years old. Was this unrecognized for years or just a new part of his journey?
It was unrecognized until we knew what was going on. And then looking back, there were a lot of kind of signs that we knew that we could connect the dots that this was what it was. He had his first seizure at 12 on the baseball field. He was at an all-star game and he was in the outfield getting fly balls and he had a seizure. Previous to that, the whole year prior, he was having stomach issues actually. And we were taking him to the doctor all the time. They thought he was worried about school or anxious or things like that. Then they thought he had acid reflux. They were treating all these things with his stomach. And we now know that most likely that was kind of the precursor to the seizures, that the gut and brain are so connected, and that was probably leading up to his development of seizures.
The descriptions of my seizures include anything from a staring episode to a full-on grand mal seizure. What led Dan to see a neurologist?
Like I said, he had his first seizure at 12. And we went to the hospital, and they basically said, this could be a fluke. It could have been the weather was really hot. And they just sent us home. And 3 weeks later, we found him on the floor, having had another seizure. We didn't witness the seizure, but we kind of knew that's what happened. And so we just sought a neurologist's advice from then. And he was diagnosed kind of without fanfare. They didn't, it wasn't this big dramatic announcement. We came in and they said, oh, he's had 2 seizures. He's got epilepsy. And they put him on medication, which altered his mood a lot. He was a middle schooler, so he already was dealing with all of those kind of adolescent hormones and everything. And then he was on this medication that made him quite moody. The same. Yes. The side effects are terrible. So he was seizure free for like 18 months. So we just thought they had told us at the beginning, it's probably something he could outgrow. And then he had gone 18 months, and we thought, oh, he's just going to outgrow it. The medication is holding him. And then it wasn't.
In 2015, I successfully off Keppra. We luckily only saw a temporary increase in my muscle tone without adding medication for spasticity. Because I was on this medication for most of my life, we noticed that I had Keppra rage, which made me irritable.
Mm-hmm. Yes. And that was not typical for Dan, because he was such a sweet boy. And then we were getting calls from school that he was getting, into fights at school and arguing back with teachers. And it just wasn't his personality at all. But again, that's what you're weighing, the seizure control versus the side effects. So that's always the choice that we're making, what holds his seizures at bay and what affects his quality of life, and finding that balance.
Where are you on this journey now?
We're right in the middle of coming out of a series of bad events. So, like I said, Dan was 18 months seizure free. We put him on, we tried new medicines once the seizures started springing up again. He was having a lot of breakthrough seizures. And then he went another 2.5 years with no seizures. And we were pretty confident that, okay, we found the medicine that works. And then a lot of things kind of started to fall apart right during his senior year of high school, and then his attempt at going away to college, and then the subsequent years. So he had been struggling with seizure control. They had been trying a lot of different medications. Some made things worse. And he ended up having a status epilepticus episode, which is when you just have seizure after seizure and there's no recovery time. And his heart stopped, and it was really, really frightening. And so they had put him on pretty heavy anti-seizure medications after that happened. he was on those for about 6 days, and he unfortunately made an attempt on his own life because he was so despondent over his diagnosis and the side effects of the medication and the way it was affecting his freedom as a 18, 19-year-old guy. So after that, we were again back to square one with trial and error with so many different medications, and he was having seizure after seizure. And then he got COVID and that made things worse. And then he had long COVID. He was sick for a very long time, and that increased seizure activity. And then he had a fall at work, and he got a traumatic brain injury during a seizure. So that was a long recovery. And finally, he was like, enough with all the trial and errors of the medication. And so we went back to a medication that we knew had worked for a long time in the past. And that started us then on our journey of looking for a surgical resolution.
Please talk about what led Dan to approach neurosurgery.
So that was a really difficult decision for Dan. We had been given conflicting advice from doctors about the efficacy of the VNS and what other options he had. He was very anxious about a lot of the pre-surgical tests that they had to do. He had to do a lot of exploratory tests, which is a lot of poking and prodding and hospital stays and inducing seizures. And he didn't want any of that. And so he kind of thought maybe surgery wasn't for him. He didn't want to go through all of that if it wasn't going to be a sure thing. So the first doctor that we had talked to had said that the efficacy or the success rate for the VNS was between 30 and 40%. And Dan thought it wasn't really worth that for that success rate. And we kind of put it aside, but then after seizure, we looked at it again, this time with a new doctor, and that doctor suggested that not only was the initial success rate higher, but that over time, the efficacy of this device would increase to 50 to 75%. And then those numbers sounded a lot more hopeful. So he decided he was ready. And we did the gamut of sort of brain mapping and seeing where his seizures were coming from and what would work, and decided that least invasively and probably most successful for him would be the VNS. So the VNS is a vagus nerve stimulator. It's a device that is, it's like almost like a heart, like a pacemaker. It's a battery that's implanted in his chest, and there are wires that go up through his neck that attach to the vagus nerve, which goes into the brain. And the technology is fascinating because it's a smart device. It can sense if his heart rate goes up, and that would indicate that a seizure is happening or could be happening. So it will send an impulse to his brain that should, in theory, arrest the seizure before it starts. He also carries a magnet. I'm thinking I should have grabbed one to show you. It's like a magnet that if he feels like he's having a seizure aura or he's worried about a seizure, he can swipe it over the device, and that will also send an impulse. And then we have the magnet if he's actively having a seizure that we can use it to stop the seizure. And it works sometimes really well and sometimes not at all.
Were there other options?
So other options that he explored were kind of dead ends for him, but are options for other people with epilepsy. Sometimes seizures occur because there are lesions on the brain that they can surgically remove, either like go in and do intracranial surgery, or they can do it with lasers now. It's amazing. And then the other option that they explored for him was something called DBS, which is deep brain stimulus, which is where they go into the brain and they actually implant electrodes that would interrupt the kind of rogue stimulation that he gets when he has a seizure. The only reason that they didn't continue to explore that for him was because the side effect, they said that it's pretty significant side effect of patients having depression from that surgical route. And because he had the suicide attempt, they were concerned about depression with him. It's not off the table. It's something that we can still explore, but I think most emergently was getting the seizures under control in the least stressful and invasive way for him. And that's why we went the route with the VNS.
Does it require maintenance?
Yes, it does. So he goes every 2 months. It was a month at the beginning, to the neurologist, and she has a wand that engages the device. And then she can adjust the amperage of the volts, the amount of time that the device is on, and then the space of time between when it goes off and when it comes on again. And so they're constantly doing this dance where they're adjusting those 3 different increments to get him up to a therapeutic level. And then they kind of can go higher until he's uncomfortable or has side effects. And then they can kind of play with things until he's comfortable. So he does that about every 2 months now.
What was the recovery like?
The recovery was pretty quick. He was in a bit of pain for maybe a day or 2. There's a incision in his neck where they went in to attach the wires, and then there's the incision in his chest where they inserted the battery. So that was uncomfortable for a couple of days. And then they wait until the patient heals from that before they turn the device on, to make sure that they're not confusing what's the surgical healing and what could be the device problems. So when they turned the device on, he had like a hoarseness in his throat. You could hear when the device came on, you could hear his voice sounded like when you breathe into a fan, like the Darth Vader kind of sound. So he had that for a while. He had sort of a cough when the device would come on, because this nerve, the vagus nerve that goes on your, I'm trying to think what side it's on him, the left side, is what also is involved with your respiration. So he would get very short breath when he was going upstairs or something like that. All of those things he's adjusted to, and they've kind of gone away as he's had the device. It's been just over a year since he had the implant. So all of those things have kind of resolved, and he's feeling a lot better. And then we just, as it gets adjusted, he might feel that hoarseness in his throat as it gets adjusted, until he's used to it.
How long was surgery and hospital stay?
The hospital stay, if he didn't have other issues, would have just been really like an outpatient. It's so insane. It's so insane that they do it and they're just like, bye. So he had to go in the night before, because he has also a bleeding disorder, and they had to do all this pre-surgical stuff. If he didn't have any of that, he would have gone the day of surgery, and it would have been an outpatient treatment. So crazy. So he did surgery in the morning that day. He had a seizure as they were getting ready to wheel him into the OR. And the doctor said, we're still ready to go if you're ready. And we were like, let's do it, because he's here already and ready. So, and we took him home that night. So he was only in the hospital that one day. And they just sent him home with it. Oh, and you asked how long was the surgery? I think it was, I want to say like 4 hours, maybe.
When was it on?
He had it done last March. So just over a year since he's had it.
When was it turned on?
So he had 2 weeks from when they did the surgery till when they turned it on. And when they turned it on, they just had it at the very lowest of the amperage, and it was like 5 minutes, and then it would come on for a minute, and then it would be off for 5 minutes. Now he has it up to, I think it's like 2.5 megahertz is whatever the amperage is, and it comes on every minute for 30 seconds. So it's pretty frequent that it's on.
Mm.
And sometimes he'll like feel uncomfortable. He'll feel like I'm getting nervous. I'm just going to swipe it. And that sends kind of double the impulse that the normal on and off impulse is. So he really feels that. It's like a jolt. So it's not uncomfortable. It's not painful, but it's definitely, he feels it coming on.
What triggers his seizures?
Oh, lots of things. The two biggest things for Dan are lack of sleep or not quality sleep, and stress. Those are the biggest. And those typically across the board for epilepsy are big triggers. Stress is a big trigger. And then we've noticed other things that could be anecdotal and could be real triggers. We noticed that if Dan is working on something that's that it's small or something that he really has to hyper focus on, putting something together or fixing things, that tends to be a trigger. Some video games are triggers for him, although others he can play for a long time. I think it has to do with the lighting around, like if he's in a daylit room and he's playing video games, it's okay. If he's sitting in the dark and the screen is on, I think that causes a seizure. And then I am convinced, although no one believes me, that Five Guys causes him to have a seizure. He loves Five Guys, but almost every time he has Five Guys, the next day he has a seizure. And sometimes he says Five Guys is worth the seizure because he loves it.
I don't remember everything, but Mom could tell when I was going to have one falling asleep to nap by my eyes.
Mhm.
No triggers for anyone include stress, illness, fatigue, and flashing lights.
Mhm. Yeah, very similar. Are your seizures happening in the day or at night or both?
I went 11 years without one. I had a big breakthrough grand mal on November 3rd, 2022. My emergency rescue medication was required to get it to stop.
Yeah, they're frightening. They're very frightening, those types of seizures.
In the
Dan-
spring of 2023, I had a standard 20-30-minute electroencephalogram where I was sleep deprived with electrodes glued to my scalp, which didn't lead us to any leads in regards to this mysterious seizure. As you know, it doesn't mean that I don't have epilepsy.
Yeah, I think that's true for a lot of people with epilepsy, that the cause is unknown. And it's so frustrating, I think, when you're dealing with something that can out of the blue, cause you to fall or lose chunks of time of your life. It's so frustrating to not know why.
"30 days before I had COVID for the first time."
Mm. I'm so curious about the relation between COVID and the seizures, because we really feel like there was an uptick in his seizure activity after COVID. And I know that illness, that virus can, it goes through the blood-brain barrier. So that makes me wonder what long-term effects have happened because of it.
Apparently, no.
You think there's no relation or no long-term?
My neurologist didn't.
Mhm. Yeah. It's so nerve-wracking when you don't know, when you have answers. But also the answers, the people that do have answers, usually it's something like a brain tumor or something that is worse than not knowing something. So I don't know. I guess it's a blessing that there is no real reason. It's just a mystery.
Is he still on medication?
Yes, he's on 3 different medications that he takes twice a day, morning and night. We just added a small dose of another medication that I think has been a huge help. He's gone now 40 days with no seizure, and then 36 days. And just yesterday, when I was talking to you, he had a seizure. And I was about to say to you that it's been, over a month, but I don't know. He was playing video games, so maybe that was it. Um, so he's recovering now from that. It was a grand mal, but not very prolonged. I think the VNS is lowering the severity of the seizures.
I require emergency medication for my seizures longer than 3 minutes. Does Dan?
Dan also has emergency medication. He has 2 different, they're nasal inhalers. And yeah, he has one that you can squirt and then wait 10 seconds and squirt again. It's like a lower dose. Then he has one that it's like it's not Narcan, but it's the same device. You squirt it up your nose. He hates it, and he actually said, "I'd rather die than you give me this medication," because it causes such bad headaches for him that he's always like, "Wait till the absolute last minute before you have to give me this medication."
It used to be rectal.
Yes, yep. And that's what they had said to me at the beginning. And he's 6 foot something. I'm like, how am I going to manage this while he's actively having a seizure? So I'm glad. I'm so glad that it's nasal now. It's
Me too.
yes, there's a lot of science um, in the way of improvement for things like this. I think since the whole brain mapping initiative, I've seen such an uptick in kind of the focus being on epilepsy and Parkinson's and Alzheimer's. And I think that they're so close to really, life-changing science. I'm just hopeful that they get the research funds and they can really improve the lives of people dealing with these illnesses.
Does Dan work?
Dan is home now. He worked for a few years as a paraprofessional, and he loved his work and he was remarkable at his work. And he had a seizure at work where he fell and he got a traumatic brain injury. So it was a really long recovery from that. And I think he's so anxious about seizures in public and away from the house. And then he's had a long couple of years of us just trying to find that control of seizures. So he's not working now, no. I wanted to ask you though, reading your resume and all of the things you do, I'm so impressed by all of the things that you're involved in. And I want to know what your anxiety level is and how are you so independent? What do you attribute that to? Is that just the type of personality you have? Is that your supporting you and school and everything? So many things, horseback riding and office man, writing a, this is amazing.
Would you like to do remote work?
Oh, that's an option. I don't know what he would like to do. I know that he's a creative person and he really loves all things creative, photography and art and music. And he does some things in that vein, but not with a paycheck.
I just have to be busy.
That's nice. It makes you feel very independent. And I think when you have a
A lot of volunteer work.
yes,
I'm
I
the
think
office manager in charge of emails, marketing, reviewing documents, and all-around multitasker for my former speech therapist's office needs. I am a co-author of Living with Cerebral Palsy, led by Kyle Scott, where each story will pull at your heartstrings and leave you feeling equally inspired by its resilience, honesty, and sheer determination. I'm also a member of Connecticut State Student Disability Council as a student of Connecticut State Community College. I'm the communication assistant and a dedicated member of many committees for my professional association of Therapeutic Horsemanship Certified Center, where I'm an avid and experienced horseback rider who focuses on paradressage since 2017.
wow, that's a lot. I feel like when you have a purpose like that and you are driven, it helps coping with, doesn't it feel like when you have something going on that you're not just dwelling on what but you're doing the things you can do. And I think that he's getting to that place now where he's finding that
I just
purpose.
have to be busy.
Mhm. It's so good. That's so impressive. I'm really I'm wowed by it. That's so good.
Please talk about your charity, Team Dan.
Sure. So we started Team Dan back when Dan was 12, and it used to be strikeout epilepsy because he was obsessed with baseball and it happened on the baseball field. And really, it was just born out of, our baseball family and community that witnessed his first seizure. All of their kids were kind of traumatized and terrified. And so we thought, what's the best way to disperse this information and um, send Dan out into the world and feel safe about that not a lot of people know what to do when they witness a seizure or even know what it is. I know that when Dan was in college, he had a seizure and his roommate thought he had a drug overdose and called the police. So there is, a lot of things that our organization kind of helped to put out there so that we as parents felt more comfortable when Dan would go to a friend's house, because we were educating people on, seizure first aid and things like that. And then the thing that we added to
remind people about seizure first aid.
Sure. So first and foremost is to protect the person's head. When Dan has a seizure, it's always a grand mal seizure, and typically the motion is like, if he falls, the motion is that he's repeatedly hitting his head on the ground. So that's our first kind of go-to, is to get by his head and protect it. If you're witnessing someone having a seizure, you could roll up a sweatshirt, you could put a pillow or a cushion if you're near that, or you can just put your arm under their head and protect their head. And then the next thing you want to do, importantly, is time the seizure. If a seizure goes more than 5 minutes, that's a medical emergency and you need to call 911. Seizures, for the most part, are not medical emergencies, even though they look horrifying and they look like you should be at a hospital. Dan does not go to the hospital when he has a seizure. Just pick up the pieces and go on. And then the other thing is just to make sure that there's nothing around that the person can get hurt with. If they have a necktie or glasses on, you might want to take those out of the way. And then the old thought that you're supposed to put something in their mouth is wrong, wrong, wrong. You should never put anything in someone's mouth that's having a seizure. And then you just stay with the person until the seizure passes and they're oriented. I usually tell Dan, like, you've had a seizure, we're at home, or wherever the situation is, because as he's coming out of it, he doesn't know what's happened, and it's very confusing and frightening for someone having a seizure coming out of it.
The EEG wouldn't help.
No. We found nothing. He's had the EEG, the 24-hour, he's had a 96-hour where he had it all hooked up and he had to wear this backpack with all the wires. And then he's done the epilepsy monitoring unit where they hooked him up to all the electrodes. And then he had video cameras on him, and they just started weaning down his medication to induce a seizure. So then they record the brain activity while he's having a seizure. And they found really nothing conclusive, nothing that pointed us in a direction or made anything more clear. So that's frustrating.
Finish charity called Team Dan.
So when we first began, we were doing a lot of baseball games, and we would go to, there was a collegiate team in the town that we lived in. They did summer baseball, and we would just kind of do bake sale type things and spread awareness. But when Dan got into school and he was on these medications, and his behavior was changing and his academics were suffering, we kind of realized the need for education in schools. A lot of the thought process was, if he's not actively having a seizure, then he's fine and he can just school. And there was not an understanding that the side effects of medication were affecting his executive functioning. They were affecting his working memory. They were affecting his fluid reasoning. So he was struggling in a lot of ways in school beyond just someone to know what to do if he had a seizure. And I think their thought was, we'll make a plan if he has a seizure. There wasn't a lot of proactive things to help him be successful at school. So we've done a lot of advocacy with schools, with parents that are dealing with their child struggling at school. We've done a lot of outreach with helping parents advocate for their children in school. And we've worked with the Epilepsy Foundation to bring advocates into schools to help parents through PPT meetings and things like that, to explain to the staff exactly what the side effects of medication cause and how those students need to be supported to be successful in school. And now we kind of are not doing a lot as far as outreach, only because Dan is no longer in school and he doesn't like a lot of the attention of it. So mainly what I'm doing is fundraising online, and I send all of our funds to an organization called Cure Epilepsy. They're amazing, and 90 something cents on the dollar goes to research, and they've done amazing research projects and have really pushed forward studies about epilepsy. So I'm amazed by what they're doing, and I support that organization through Team Dan.
Please discuss how you advocate for mental health and empathy for siblings of children living with complex medical issues.
So when Dan was diagnosed, his youngest sister was 7. And almost her whole life she's lived with Dan being ill. And it's traumatizing. Witnessing a seizure is traumatizing. Living with someone that has complex medical issues where you're worried all the time that they're going to be sick or something's going to happen causes a lot of toxic stress. And we know that can have long-term effects on people. Dan has 2 sisters. He has an older sister and a younger sister, and they've had mental health issues from dealing with having a brother that has a life-threatening illness. It's frightening. It's in a high level of alert all the time, that we're just if there's a sound in our house that we can't identify, we're running to see. So, someone drops a cell phone and everyone's running, and Dan's like, oh my God, he gets annoyed by it, but we're always like, you scared us, and that gets it. It's a lot for young people, I think, to. The other thing is that she was so little when he was first diagnosed. And when you think about a child that's experiencing a trauma that needs their parent, and we choose to be with Dan to administer first aid to him. And so she kind of had to deal with that on her own until we could get to her and help her process it. So that caused a lot of sort of this abandonment trauma from her. So we just see it a lot, and we try to make sure that as much effort as we're putting into caring for Dan and making sure that he is okay and stable, we have to make sure that we're addressing how our other children are processing and living with it, because it's complicated. Their lives are competitions? Same in your house. Are your both sisters younger than you? Okay. I remember Kierden as a kindergartner.
Thank you, Susan, for doing this with me.
Oh, you're
It's
welcome.
great to have you on. Please share this talk show with your family, friends, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.